ideally, our grown and matured teeth should be able to chew something or bite something, and something in this case is food. Good food, whether raw or cooked, where raw here could be something like sugar cane, a fruit, or cooked one, which could be like, rice, fries, githeri. In my country, githeri is that mixture of beans and maize and so on, and still have you enjoy the food comfortably. That should be the normal. However, sometimes you might come across a case where you are having bleeding gums, or you come across someone who has bleeding gums whenever they exert pressure on something, and where something in this case could be food, or even sometimes not necessarily when they actually insert any pressure. Now, when you happen to have bleeding gums, one, you should be concerned. It should be a point of concern that should actually have you visit with a dentist. Hello everybody, and welcome to today's episode, where I will be talking about the issue of bleeding gums and just how it should concern us and what we should do in the event of this happening. Our mouth and our teeth are meant to bite things that are edible, number one. Number two, things that are comfortable, that really won't hurt us. So again, watch what you do with your teeth. Sometimes we put this pain or this discomfort to ourselves by turning our teeth into weapons or turning our teeth into tools. I'm sure you've come across, or probably you are one of those people, say, who would open a bottle of soda with your teeth. Who would want to actually snap a button from a cloth with your teeth. You want to open, to twist something, or to even loosen a bolt or a nail or a rivet with your teeth and so on. That's already wrong. That's not the work of the teeth. That is harming your dental formula, number one. Number two, you're introducing germs into your mouth, because, what does a nail have to do with your mouth? And then for a bottle of a drink like soda and so on, that's why we have bottle openers. And there's no way your mouth or your teeth will replace the bottle openers. So again here, let's just start by having our teeth be used for what they are meant for. Anyway, back to what I was saying. So in the event that you realize that every time you have a bite, you feel a discomfort, and number two, you realize that your gums are bleeding, should be a point of concern, and make a date with your dentist so that they can be checked, because this could be an indication that something is not right. Either you are low on calcium, and that's why every little pressure on your gums makes them bleed, number one. Number two, it could actually be a sign of gingivitis. I hope I said that correctly. An early stage of periodontal disease, which is a dental disease, and so on. So if your gums bleed easily, or just whenever you brush, even sometimes, then you want to see your dentist. Now again here, brushing, when my gum bleed at every moment I brush, might not automatically mean they are sick. You also have to check at what brush are we talking about here. Now a toothbrush, just like a handkerchief, just like your briefs and so on, have to be changed once in a while. So once again, the first question you need to ask yourself, are you using the right brush? Some people would want to use a toothbrush until the last bristle, drops. That's already wrong. Medically, a dentist will tell you, use your brush for this number of months, then dispose it off, because now it has become rough and no longer helpful. Always remember to brush your teeth with the right brush, and whether in this case it's your baby you're brushing or it's yourself, use the right equipment, so that then you are not, in the course of brushing and cleaning your teeth, actually ending up hurting your gums. Another reason that could be making your gums bleed, apart from you misusing your teeth by opening bottles and so on, number one. Number two, by you probably using a wrong brush or an old brush, could also be actually if you share brushes, if you share toothbrushes. I mean, whether you are a couple or whether you're siblings or whether you are friends to I don't know what level, why in the world would you actually be sharing a toothbrush? Because you see, again, our dental formulas are different, so is the dental bacterial formula as well. So if for example, I happen to have an infection, a dental or a gum infection, and then you actually end up using my brush, that's how I might also pass this infection to you, and you also start having bleeding gums. So yeah, stop using teeth for different reasons that could result in you having bleeding gums, number one. Number two, stop using very old or rough brushes, because that might end up hurting your gums and hence make them bleed. And number three, stop sharing toothbrushes. They are only meant for one mouth for that time. And therefore, you using and someone else using might be the very formula that the bacteria or the infection actually gets spread. Okay. Now, some people might also experience bleeding of gums when they floss, and especially when you're a first timer and so on. You might realize that once in a while you experience some bleeding gums and so on. That should not continue though. So if you continue experiencing that even way like into you flossing, after you have now gotten used to flossing, then it should actually be a point of concern. Just the fact that someone's gums are bleeding might not be final, might not be a done deal that probably they have like an infection and so on. You might want to look at the journey of this person before we conclude anything. Because again, depending on the stress you've put on these teeth, you might actually realize that sometimes you just start bleeding from nowhere, even without exerting any pressure. Can you imagine you are in a meeting or you are in public and so on, and then someone goes like, gosh, you are actually bleeding, and so on. It might end up even messing your clothes. It makes you uncomfortable. It might make those people around you uncomfortable. I mean, for God's sake, it's blood, and so on. So yeah, let's be gentle on our teeth. They are very important. They help us, and we will get the gentleness back. And again, like I mentioned this in my earlier episode about halitosis, let's also take dental appointments very serious. Let's get to have our mouth and our teeth professionally checked once in a while, so that then we know we are on the right track, and also so that in case there is any underlying condition that probably might blow up soon, that it can be contained way in good time. Thank you so much for your time. Again, like I keep saying, let me know what you think. I hope these episodes are helpful to you as a parent, as a child, as a parent, or as just an adult, for you, self and yours. And yeah, share also your experiences of such like things. Don't forget to like, share, and subscribe, guys.